Sex addiction, is it a real thing? Indeed it is. And if you're struggling with pornography or sex addiction, I want you to know that I know what led you there. I know what it feels like. And thankfully, I know the way out. I'm Dr. Trish Leigh, sex addiction and brain health recovery coach. I want to share with you that sex addiction and pornography addiction is a very real thing. And what led you there is, first and foremost, a dopamine dependency. We know when you find pornography, or if you were exposed to early childhood or adolescent sexual experiences, it can flood your nervous system with the neurotransmitter dopamine. Dopamine is responsible for motivation, more, insatiably more, and pleasure. So when your brain was flooded with dopamine at those first exposures, it wanted more dopamine. And in those moments, your brain recalibrated to need more dopamine. These are the seeds of addiction that are planted when you're very young. This is what I think makes pornography and sex addiction so insidious. So what led you there is definitely dopamine at the core of the neurological dysfunction or dysregulation that happened long ago. So basically, your brain stopped developing in the optimal mode, and it began developing with a greater need for dopamine. We know this from scientific studies. Also, there is trauma and dysfunction. So if you have early childhood sexual abuse, we know from studies that this can be a core driver back to sexual experiences that are very similar, to have some control over experiences that you didn't have control over when you were young. And of course, this is happening at a subconscious level, but it's neurological in nature that then unfolds in the psychological and the physiological. We all lose sight that our brain is the thing that is controlling our mind and our bodies. So there can be early trauma and dysfunction. There's definitely dopamine dependency, and there also can be sexual abuse. But when it comes to sex addiction and porn addiction, it's multifaceted. It's a deep end issue, not a shallow end one. So those seeds of addiction were planted when you were young. That is what leads you back today, decades later. So if you find that you continue to go back to a particular behavior or to particular scenarios in your porn or sex addiction, it's because there's a driver that's been in there for a very long time, and it's driven by brain dysfunction. So now you can't stop going back to what is giving you pleasure in your brain. This is dopamine dependency, and this is compulsion. So I get the question all the time, you can't be serious that masturbation's bad for you. If masturbation is compulsive, meaning you feel the need to go back to it to feel pleasure or to escape pain, ultimately we know it's creating more pain in your life. You know, I always say, if it's your brain controlling you and making you do it, then this in fact is a compulsion. Now, this video comes on the heels of many conversations of people who are riddled with shame. Their lives are on the precipice of falling apart, and they know they're not choosing to go back to the behaviors. And I sit with no judgment and, a heart that is very concerned for people in this position, because the compulsion means they have to do it, even if they're no longer enjoying it. That is one aspect of addiction. You continue to do it even though there's negative consequences in your life. So what does it feel like? What it feels like in the moment is, yes, there is the exhilaration and the rush, because that's the dopamine. So you are enjoying it in the moment because of the high levels of dopamine. But that is because you need it, not because you want it. And so what it leaves you is feeling demoralized. It leaves you feeling shameful. And it also leaves you feeling terrified and scared, knowing you're going to have to go back for more of that, because your brain needs the high levels of dopamine from the behavior that you've linked it to. Now, many partners don't understand the essence of sex addiction. If they find out that their partner has cheated on them, or if they are caught up in porn, and when I use the word porn, I'm using it lightly, because anybody who's been exposed or has a strong porn habit, they know the genres and the scenarios. They can be very violent, they cross your moral bounds. This is tolerance building and escalation at its finest. You click into something you don't want to, but that rush of dopamine in your brain makes you stay, and it makes you click into something else. Partners don't understand this. This is the essence of addiction. This is what makes people do things they don't want to do, but they feel like they need to do it for that continual dopamine rush. Now, I am not excusing infidelity or porn use, obviously. I am trying to explain it because there's people who are caught up in behaviors that it seems like they enjoy because they can't stop, but the fact that they can't stop indicates compulsion and addiction. So what it feels like in the moment is, yes, it is exhilarating, but it's terrifying and demoralizing for most people at the same time. So that's what leads you in, and that's what it feels like. Now, to me, the most important question is, how do you get out of it if you want to? So I've already shared with you, there's people whose their lives are about to crumble apart. I tell one such story in my new book that's coming out, Mind Over Explicit Matter. I tell the story of Sam. He's about to get fired. His wife's about to leave him. His children don't know that he's addicted to sex, but they know they don't want to be around him most of the time. So the relationship with his kids is starting to falter also, and he can't stop going back for more. He's actually, I didn't put this part in the book, it's a real story. He's actually been in trouble with multiple organizations too, because he keeps inappropriately touching women or making comments to them. So he's basically been kicked out of a few places too. So if you find that you're in trouble with the law, with your partner, or with your employer, this is escalation, compulsion, and addiction. Nobody wants to be fired. Nobody wants their wife to leave them. Nobody wants their kids not to talk to them. And nobody wants to get thrown out of an organization for being inappropriate in sexual ways. Addiction and compulsion. So how do you get out of it? First of all, you recognize there is a dopamine dependency at the core. Your brain is addicted to high levels of dopamine. This, to me, is the terrifying part because it's an internalized drug addiction. Your brain needs more of the neurotransmitters and the chemicals that get flowing. Dopamine's the primary one, but there's more of them. And basically, it's offsetting pain and it's helping you feel pleasure in the moment, but without you realizing it, it's causing all the other stuff that you're dealing with: anxiety, depression, erectile dysfunction, all of the mood challenges that you're having, low productivity, difficulty focusing, memory issues, brain fog. All of that is scientifically proven to be caused by pornography use and sex addiction as it ramps up. So dopamine has to be scaled back. And this is the easy way to think about it. No longer getting unhealthy levels of dopamine from unhealthy sexual sources. Healthy, I'm not saying good or bad. I'm saying healthy or unhealthy. So please hear that. So then when you have committed, let's say, to not getting those high levels of dopamine from unhealthy sexual sources, what do? It's time to rewire your brain back to optimal healthy levels that don't need excessive dopamine. Now, I'm here to tell you that part is very tricky by yourself. That is why I established my coaching practice to help people do just that. Rewire their brains using advanced technology back to homeostasis, to the level that doesn't need high levels of dopamine. So when I work with people, the first thing we do is called a qEEG brain map. I'm able to identify how much dysfunction is in the brain. It's able to be visualized on the brain map. You can see it too. We have to see the levels of dysfunction so we know what needs to happen to bring your brain back to those healthy levels. Once we identify it in the brain map, we use advanced technology called neurofeedback in my practice to be able to fairly simply and fairly quickly readjust your brain's levels back to those ideal levels. Now, when that rewiring has happened, now you're able to reset the pleasure pathways back into your real life, meaning now you get lower, healthier levels of dopamine from healthy, real-world sources. And of course, that includes establishing a healthy sex life with your partner or your future partner, if that's what you're looking for. But I want you to recognize there's dopamine dependency that needs to be dealt with, and we need to deal with the fact that your brain has changed the way that it's developed and that it's functioning to have to go back to these high levels of dopamine. At the same time, we also want to address trauma and dysfunction, those patterns, those behaviors, those experiences that also are core psychological drivers. So we also address that. So essentially, we're resolving the need to use porn or sex, and at the same time, rewiring your brain so it doesn't need all that dopamine anymore. All right, so if you are caught up in sexual behaviors, when I talk with people, They will tell me about experiences that they think are very high level experiences that I've never heard about before. I am privy to people's experiences that, of course, I keep in the vault. And I know if you're struggling with something that you think is so far fetched that nobody would understand and nobody's heard anything like it before, I have. That's exactly who we help. If you no longer want to go back to whatever it is you're going back to, then please go over to drtrishleigh.com. We can help you. We help people like you all day, every day. If you're up for my new book that's coming out soon, go over to Amazon and pre-order it, or wherever you buy books. It's called Mind Over Explicit Matter. It provides the roadmap and the blueprint to get started by yourself. All right, until next time, control your brain or it'll control you.